Well, good evening and welcome to Senior Info. And I want to announce that, and you haven't heard this yet, Kelly, we're going to do this twice in a row. We're going to do Senior Info next week if you're interested in coming. We're going to have someone here that to talk about senior travel.
Oh, nice.
Oh, so trips and
Yeah.
okay.
Yeah.
And traveling
All right.
by yourself, maybe, not with a partner or
Right.
friends,
Well,
or yeah.
whatever, yeah.
But going with a
Another
group
friend of
or...
Russ.
Oh, of course. Hi, Russ.
Russ is like the booking
Where are
agent.
you, Russ? Are you watching?
We love Russ.
But our guest tonight is Lynne.
Alexandrowicz.
A
A Polish man can't
I
pronounce
know,
a
I can't.
Polish name.
I don't even speak Polish either. I speak more French than
My
Polish.
father is still pretty good at speaking Polish, yeah.
My grandmother didn't speak any English,
No.
but,
My Jaji didn't, yeah. My grandfather didn't
Yeah,
speak English
no.
at all, no.
right, but we didn't live nearby. We were
No.
still in the same town, but, you know,
Right.
you were up on Benton Road, about 3 miles away from us and down in the French part of town.
That's
Right.
right. Well, we'll
So-
give you that you can pronunciate my name. Because you grew up in the French part of the town.
That's why. Yeah.
In fact, everyone spoke French. That's all I heard,
Oh, okay.
but I don't speak
Speak
that
French.
one either. They would stand on their porches at night in the summer, and you hear them going back,
Back
and forth.
I know. You admit that that doesn't happen anymore.
No.
Unfortunately,
No,
those
you
days
don't.
are
When
gone.
I first started at the senior center 11 years ago, they had
Mm-hmm.
a French club, and
Oh,
they
wow.
would sing, especially at the holidays. They would sing their
Oh,
songs
how
in
nice.
their French
Is that
language.
no longer?
It's no longer.
Oh.
But that was neat for me
Yeah.
to, come upon the scene and be like, oh, yeah, because it was a big part of this community.
Yeah,
Yeah.
absolutely. Absolutely.
But Lynn is an advisor
Yes, yes.
for people who are going to need Medicare in a way, home care,
Home care, yeah. I'm going to talk about home care today and also about nursing
home
homes.
care.
Yeah. So I've been in the industry for 40 years, and actually I know Kelly years ago before she started at the senior center. So we just had a little mini reunion, which was
we
quite
did.
nice.
Yes.
And we both started in a really young age in this
Very
industry.
young. Yes. Yes. We were teenagers.
Yes, we were.
Yes.
We were. And the landscape is constantly changing, exceptionally this whole month with everything that people are reading in the news and seeing on TV with, hospitals merging, filing Chapter 11, nursing homes, getting bad reps, and it's kind of a mess right now. So what I wanted to do is kind of talk today about nursing home care, and then I'll talk about home care. Let's start with home care because that's kind of the progression.
Right.
So right now in the state of Massachusetts, there are two forms of home care. So there's a Medicare certified home care, and everybody uses the term V&A. So that's kind of a popular name for anything that's a Medicare certified. So what that basically means is that Medicare pays for your care at home.
And that's through the Visiting Nurse Association.
Right, V&As, yeah. So there's probably right now, a couple hundred V&As, Medicare certified home care agencies throughout the state, from the western part of the state down to the islands down the Cape. And then there's private home care also. So private means you pay privately. So that
Right.
Medicare does not cover that, or Medicaid does not cover that, or insurance does not cover that. It's
That
a
would be like the
private cost.
Visiting Angels.
The Visiting Angels, or I represent Accessible Home Care, which is a
Yeah.
private pay home care agency.
Right.
So I'll kind of talk about the differences. So
Now, does insurance cover that in any way?
no,
No,
that's
it's
private.
private.
That's why.
I mean, no, but private insurance.
No. So unless you had long-term care insurance, which some people did purchase years ago,
Yeah.
bought policies, and when depending on what policy they had and what premium they were paying, it could cover nursing home care, it could cover assisted living care, it could cover home care. An example, let's say their policy covers home care and it says, I'll pay for, 20 hours a week at this rate. So if families have a long-term care policy, they can utilize that and then supplement it with additional care out of pocket. So we do take long-term care insurance, and a lot of other private home care agencies also have a veterans contract or what they call an aid and attendance program. So if you were a veteran or your surviving spouse was not a veteran or was a veteran, they might be able to get some supplemental funding towards home care.
Through the VA.
Yes, it's called aid and attendance, so it's separate than the VA. So aid and attendance is a criteria that you had to serve during a wartime, and you had to have an honorable discharge. You had to have all your, legal papers, and you also have to have a certain income level. So it has to be, can't be, above this by a penny. It has to be below this by a penny. But that does supplement, and it does cover, which is nice. So it's not only for the surviving spouse, but, if the veteran has passed on, the surviving spouse can also utilize that services as long as they can get that paperwork together.
Right,
So,
right.
yeah. And we actually utilize him. He is a Major Jones in Florida, and he works for our organization. So if anybody is interested in an aid and attendance program, we basically give him their information and he reaches out because it's very, very, what I want to say, there's so much paperwork that's included to get
Right.
that information that's needed.
Exactly.
Yeah,
Well,
unfortunately.
anyway,
so.
but government funds come into it, there's a ton of paperwork.
Right, right. So basically in Massachusetts, which is nice, is we have so many options. We're not living in the Midwest. So we have great hospitals to choose from. We can go to
Yes.
Boston. We can stay in the Central Mass area. We have numerous doctors and specialists. And we're not living in the Midwest where we have to drive 3 hours to go see a specialist or 4 hours to get to the nearest ER or hospital. So we are graced with that.
Right.
But at the same time, it's oversaturated at times. So there's probably a couple hundred Medicare certified home care agencies, and then there's another couple hundred private pay home care agencies. So people have choice. So I recommend that people look on websites. They look at everyone has a star rating by the CMS, the Centers for Medicare and Medicaid. Even private pay home care agencies have a star rating. So the star rating usually ranges anywhere from 1 to 5, 5 being the best, 1 being the worst. You would think 1 would be the best and 5 would be the worst, but it's opposite.
Oh, okay.
So you want to always look at what the star rating is, and you can go online. You can look at mass.gov, and it will list not only for nursing homes and home care, but hospitals and how they're rated. And
Well, that's the state website.
yes,
Yes.
yep.
Oh,
So you can
okay.
pull up anything that you would like to see the rating, and most of the home care agencies that have on their websites what their star rating is, as well as nursing homes do too.
Right,
So.
but you're getting what do you call? On the state website, it's not affected by them.
Right, exactly,
Right.
exactly.
You're gonna get a true reading.
Absolutely. So on home care, usually what happens, let's say someone slipped in the parking lot with all the ice that we've had recently. They
Yeah.
unfortunately broke their hip. They go to the hospital. They get a MRI. They say they need surgery. They have their surgery. They're at the hospital for a few days. Then they're going to probably go to
A rehab.
they could go to an acute rehab hospital. In this area, we happen to have Fairlawn Hospital or Whittier. In Boston, you've got Spalding. Everybody's pretty much familiar with Spalding.
Right.
But in Worcester, there's Fairlawn, and then in the Westboro Marketplace, there's Whittier. So let's say you progress from the hospital to an acute rehab hospital, and then you still need additional care. You could go to a nursing home for short-term care.
Right.
And then when you're discharged from the nursing home and you go home, now you probably haven't been there for 5 weeks.
Right.
And you're left in an ambulance, so, and you might be living by yourself or whatever. So that's where home care comes into play. Home care would come in, and usually what happens is a Medicare certified agency comes in, and they'll send in nursing, they'll send in physical therapy, occupational therapy, maybe speech if you had a stroke or what have you. And then they'll do how many weeks or whatever based on your diagnosis, as well as what you have for insurance. It's all insurance driven. Welcome to
Yes.
healthcare. Yes. And then, and once they finish up, then private home care can come in and supplement and help out. So it's kind of that progression of.
And now the private home care is not covered by insurance.
It's
No.
not. It's private pay.
Yeah.
So that's private pay. And usually there's a couple hundred different private home care agencies to choose from. And I do recommend to look at their star rating, look to see if they're a franchise or if they're owned by a nurse. Do they have RNs on staff with them? Some are non-medical model private pay and some are medical model private pay. At Accessible Home Care, we're owned by a nurse who has over 40 years of experience in this industry. And we are a medical model, so we have RNs on staff with us. So we actually go into assisted livings and we do IVs. We can do, for anyone who's a diabetic and they need injections and maybe they have a sight impairment and they can't do the injections, we can go in and do the injections so they can still live in an assisted living format. And we do a lot of IVs lately, unfortunately, and you know they're being sent back to their assisted living with IVs, which 5 years ago that never happened. So we go in and we do a lot of wound care also. So if someone is a diabetic or has a bad wound and they're being sent, and you know, let's say Medicare says we're going to pay for 3 wound changes per week, but you need 5. The doctor's saying no, it needs to be changed every day. So that's where we come in and we'll send in our wound care nurses and they will pay privately for us, but we'll do the additional 2 other days that's needed for the wound to heal.
That's too bad, the insurance isn't, you know, if your doctor requires it, you need it.
I know, it's all insurance based and insurance driven, unfortunately. So everyone has options, which is good, but I say when someone's in a hospital and your loved one's there or yourself, be an advocate for your own care or your loved one's care. You know, and speak up. So you're working with case managers who have an incredible caseload. They're working 12-hour days.
Yes.
Some of them 7 days a week, 5 days a week, 7 days a week, 12-hour days. They're overwhelmed. They have a huge caseload. If they say, listen, we're going to send your mom to the ABC nursing home, and you want her to go to the XYZ nursing home, and there's a bed available, and they have the insurance that, you know, your loved one has, you can speak up and say, no, I would like my loved one to go to this nursing center.
Right.
You know, and it's the same with hospice. There's a couple hundred hospice companies throughout the state. In Central Mass, there's probably about 20 in this area now. And you have a choice. Again, it's patient choice and advocate for yourself too, so, which is very important.
Yeah, so you should check out the companies you want to talk to.
Absolutely. I recommend that people call 3 or go online and look at 3. Don't look at 20. You're going to be overwhelmed. Same thing if you're looking at assisted living. So you're looking at nursing homes. Look at 3 and look at based on, you know, in the insurance, the bed availability, what their star rating is. Geographically, is it easy for you as a loved one to be able to go there and visit on a daily basis if needed, or are you driving 4 towns over to get to that nursing center?
Right.
You know, and what the specialty is. Each nursing center has a specialty too. So again, walk in unannounced. Don't make an appointment. Walk in unannounced. Say you'd like a tour. You know, everything's comes from the hospital is all on the computer, so they have all that information already. So they, you know, ask questions who their medical director is, what the staffing ratio is, what their last survey was. So the state comes in and does a survey once a year in the nursing homes.
Right.
And they look from everything from food to cleanliness, from maintenance to staffing issues to medication errors to everything. So, and that is always in a 3-ring binder, and it's always in the lobby of the nursing home, so it's always present. So if you have 4 hours to kill and you want to look through that book, feel free.
Good reading.
Or you can go on the Mass.gov and you can look at the results there too. But very important because again, a lot of people say, I remember I had a gentleman call me and said, oh, I'm going to send her to this nursing home and they have a 1-star rating. And I was like, no, you want a 5-star rating.
Right.
But he was
The
confused
opposite.
thinking
Right.
1 star is the best, right?
Right.
That's how we all
Right.
grew up thinking
Yeah.
that, right?
Right.
So, so I say go in, tour, ask a lot of questions, interact, see how the staff is interacting with the clients, the patients, as well as the family members are there, see what activities are going on. You know, I always call them the sight, so the sight and the smell. Look at those 2 things when you're going in. And, you know, some people will walk into nursing centers and say, oh, my God, I feel like I'm in a hotel room. a lobby of a hotel when I walk in. That's great, the chandeliers, the rugs, what have you, but the care is important,
Right.
the staffing ratio is important, the star rating is important, and, don't be swayed by the chandelier or the carpet.
Right, get into the rooms and,
Right,
Right.
right, and see
Are
what
they
the care is,
clean?
and
Are
watch
they-
the interaction.
Talk to.
Yeah, talk
Yeah.
to family members,
Yes.
talk to people who are there visiting, ask a staff member, do you enjoy working here? You can always tell if they smile and say hi, they're usually happy. If they just look at you and go,
oh,
Run! Get
"Yeah,
out!
right,"
not another one.
And within a nursing home, you have a director of nurses. You usually have an assistant director of nurses. You have an administrator who's licensed, who took, 6-7 months of training and then had to take a national exam and has to keep their license up. You have a case manager who's usually an RN or an LPN, and then you have a rehab team made up of physical therapy, occupational therapy, and speech therapy. So look at that, especially if your loved one has had a cardiac issue, a stroke, or orthopedic, and they really are going to have intense, rehab,
Right.
physical rehab, or speech. If they had a stroke and they had paralysis, really, speech therapists are very hard to find these days. We are blessed at Shrewsbury. We actually have 2 on staff with us. And our staff is our staff. We're a lot of different nursing centers right now because there is a shortage. Hire out a rehab company. So they're a third-party contractor. They work there, but, their paycheck does not say the ABC
Right.
Nursing Center.
Kind of like a
So,
subcontract.
that's a question
Yeah.
to ask, which is really important. See if they have an outpatient center at the nursing home, too. So if we do at Shrewsbury, which is wonderful, I represent 2 companies today, but Shrewsbury Nursing Home is a family-owned nursing center. And there's probably only 5 in this area that are still family-owned. Everything else is corporate. We call it the big box, right? The big box. So
Right.
it's all corporate people out of state that own a lot of the nursing centers, the chains that you read about all the
And they're
time.
only looking at the bottom line.
Right.
At times,
usually.
yeah, at times. So, it's important asking, staff how long they've worked there. And when we at Shrewsbury have some staff that have been there, we've been open for 50 years. We have some staff that have been there. They worked there when they were in high school, and they went on to nursing school, so they've worked there forever. Which says a lot. Also,
Yes.
it's very important. Yeah, and to get back to rehab too, it's important. So if you need to go to outpatient after you go home, you can have the same staff. We have an outpatient clinic on the premises, and they can come and have the same rehab team that they had while they were inpatient. What's nice too at the outpatient center at Shrewsbury is a one-on-one. I don't know if you've ever hurt a limb, had surgery, had to go for physical therapy. There's so many physical therapy outpatient centers now. They're on every corner as you're driving. And sometimes you go in and they've got, maybe that physical therapist has 5 different clients at the same time. So you go in and they say, okay, go over here and do your do your reps and do this and that. And all of a sudden you're like, well, where'd they go? I don't know where they are. At Shrewsbury, our outpatient center, we have a one-on-one. So it's quiet, and you only have that one patient to that one professional, which is nice.
Nice.
It makes a big difference. So, yeah.
Yeah,
I know it's an overwhelming industry.
It's a lot.
It is.
Right.
It
You know,
is.
I know for many years, all the nursing homes were owned locally.
There were. That's no longer the landscape
Right, now
anymore.
it's become a national business.
Right.
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 Big business.
Yeah.
Yeah.
Like I said, there's
And-
probably 5 in this area now that are still family owned, and that's it.
Yeah,
Which is
they're
sad.
owned by
so.
huge conglomerates.
Yeah, and when years ago you went to the nursing home and you never came home.
Right.
Right.
That was your permanent place before you went on to heaven. But
Yep.
unfortunately, now you're going in. Or fortunately, I should say, now you're going in for short term. So you go there, you might. Again, we'll go back to you fell on the ice, you broke your hip. You're now getting rehab there. You might be there 21 days, 28 days max for short-term stay, which is really
Well,
important.
many years ago, if you went into the hospital, you stayed there till you were ready to go home.
Now it's drive-by.
But to keep, so now to keep their costs down, the insurance companies,
right.
as well as Medicare, you're only there for a short period of time, and they send you to a nursing home because
Right.
it's cheaper to put you in a nursing home.
Right, right. And then Medicare instituted a couple of years ago too, if you are in the hospital and you go to a nursing center and then you're discharged home, And then within 24 hours of that discharge, you're back in the ER again.
Yep.
So Medicare then finds the hospital and they find the nursing home at the same time. So the nursing homes really work to keep you
Yes.
in the nursing
There-
center.
There's
Yeah.
an incentive
Yeah.
for them too.
Yeah, you know,
Yes.
and they, you know, contract with multiple hospice companies now. Again, there's hundreds of hospice companies in the state right now. And they contract so you can have hospice. If your journey, your life's journey is coming to an end and you are a permanent resident of that nursing center, you can choose what hospice company you would like to go with.
Right.
And the hospice staff comes in and they work with the staff at the nursing center.
Right, and you can have hospice at the nursing home or at home.
Or at home,
Right.
right? Accessible home care, we work closely with a lot of the hospice companies, and our staff can actually, because we have RNs on staff, can actually do the meds.
Nice.
So as long as it's pre-measured, pre-poured, our nurse to the hospice nurse works closely, and our staff has been trained. So because, you know, it's very hard for a loved one taking care of their loved one at home and they're, you know, passing and they're trying to, you know, administer morphine or something. It's very, very difficult, you know, so. And a lot of times people will be on hospice and families think, oh, I've got hospice now. I don't have to do the 11 p.m. to 7 a.m. shift staying with my loved one. Well, you do.
Yeah.
So the hospice team is not there 24/7.
Right.
They're there a lot, but not 24/7, and that's when we come into play. Private home care agencies come in, and we will supplement that time. And again, a lot of hospice companies work with agencies like ourselves, Accessible Home Care, which is owned by a nurse, and have RNs on staff where we can do the meds, which is important.
Right.
So,
Absolutely.
yeah.
But
So
Definitely.
that becomes private pay.
that is
Yes.
private pay. Yes.
But-
Yep.
And you can you actually get 24-hour care?
You can, so we do live-in care, so that the term live-in means that you actually, an aide comes and lives at your house. They have to have the certain criteria.
Yeah.
They have to have their own separate bedroom and adhere to the Massachusetts labor laws, so they have to have so many hours of uninterrupted sleep. But they are that permanent staff person who is there, which is important because, again, a lot of families have moved on and moved out of state.
Right.
So, you know, mom's living by herself. Mom can't stay living by herself. We have to look at options. One of the options is, does she go to an assisted living? Does she go to a nursing center? Or does she stay within her own home? And we bring home care in, a live-in, so she can stay there as long as possible with care. As, you know, as her diagnosis progresses, whatever.
Right.
And then you have other options to choose from. But live-ins, we do statewide. So we have staff that go down to the Cape for a live-in. They go out to the western part of the state. We also do 24/7 care, which means we have probably 2 staff members that do 12-hour shifts.
I
So
was going to say, not one person is
No,
doing it.
no.
So it's not a
no,
live-in
and they are
situation.
up the
Yeah.
whole time. So if somebody is active and they are, you know, have Alzheimer's and they're exit seeking and they're sundowning and they're exit seeking, you want to make sure that staff member is up during the night. So we have 24/7, which means the staff is up, you know, is there all night long and
I'm
staying up.
surprised if someone to do that kind of hours.
Yeah. Well, it's just
Right.
like in the nursing home.
Right.
You know, there's 3 shifts.
Right.
So,
Right.
yeah.
Yeah, and there's a lot of aides in the different agencies who only want, they'll request that they only want to do live-ins. So they really get to know the family, they become part of the family. We just recently had a
But
staff
when
member
they
that
have
went to a
time-
wedding. They you know, escorted the loved one to the wedding,
Right.
and they were part of the family, and they were
course.
at the wedding, so.
Yeah.
Do you ever get time off?
They do, yep, they do, yep. They take vacation time like everybody else, and life gets in the way like everybody else's lives, and kids get sick and family members get sick, so they do
Right.
take time off, but we always have a backup, which is
I was
needed,
going to say,
so.
but if you're assigned to that person like that,
Right,
you know, you don't have weekends or,
no, you have time off, you have so many hours per day uninterrupted to yourself, but, you know, you're there 7 days a week,
boy,
and
that's
what's
good.
nice is they
God
can,
bless them.
they can
Yeah.
be there, they can, you know, drive their car or drive the family's car, and go to the store, bring that loved one out to maybe a
Right.
follow-up physician's appointment, or, you know, go to, you know, Market Basket, or
Yeah.
or Shaw's, or wherever, CVS, or, you know, take them out and go to a family reunion or what have you. So there's a lot of things, you know, when people think just coming in and home care just comes in and helps you with your ADLs, which is an acronym that is Activities of Daily Living, which basically means dressing, washing, toiletry.
Right.
So, but they also do so much more. So they do light housekeeping, private pay. They do light housekeeping. They do light laundry, light meal preparation. You know, they take the dog out.
Yeah.
They safety sit. And you know, there are so many different agencies out there. I just want to point out a few things too to look at is that you want to make sure that the agencies are insured, bonded, how long they've been in business, are they a franchise, you know, are they private? Just, you know, I meet people and say, how did you get into this industry? How did you, you know, open up an agency? And just one gentleman used the answer to me, which still shocks me, is that, well, it was less money to buy a home care agency than a Dunkin' Donuts franchise. And I went, good luck. Because you really have to be passionate,
Yeah, I was gonna say, you
compassion,
could have
empathy, know this industry,
Right.
you know.
really
So,
more to it.
devoted to what you want to do.
absolutely. Well, another thing, too, is important because someone's coming into your house. You want to make sure that they are certified home health aides and they are
Right.
certified nursing assistants, and we constantly are re-educating and having you know, continuing hours of education for the staff. A lot of our staff are nationally certified dementia practitioners. I'm a, you know, CDP myself. And you also want to know on CORI checks. So those are criminal background checks. Again, we have our own alphabet soup in healthcare, and a lot of unique because Massachusetts outlines, you know, Rhode Island, Connecticut, New Hampshire. So if someone was working out of state, let's say Rhode Island, because we're close to Rhode Island and Northbridge, someone was working in Rhode Island and unfortunately they had a situation that occurred and they probably should not have their license anymore. They could actually just cross the border, come to work in Massachusetts. If you're only doing a Massachusetts CORI check, you're not going to know that on Rhode Island their license
Right,
was pulled.
right.
So on a national, we do a national, and we look at every state to make sure
Smart.
that you weren't working in Arkansas and all of a sudden you ended up in Massachusetts
Right.
and you had a blemish on your.
Well, it's another
You
thing, you know, not to necessarily a neighboring state, they come from far away. It's
A lot of the aides are from Ghana, from South Africa,
Right.
and you know,
International.
Europe, and we see a lot coming, you know, from Canada too. So, you know, and we have a lot of nursing schools here. So people going to nursing school, but they have to do so many hours as aides. So we have a
Right.
lot of aides who are attending nursing school also. We happen to have aides that have been with us. We just celebrated, Accessible just celebrated our 5th year anniversary last Saturday, which is exciting. We're women-owned, and our co-owner and clinical director is an RN. Has been in the industry for about 40 years. Ruth Langway, I don't know if you know Ruth. Okay. She's been in the industry for a long time. So, and Martine Beaumont are the two owners. We're based in Auburn, so we have staff throughout the Central Mass area, but if it's a live-in, we go anywhere within the state, too.
Good to know.
So,
Oh,
you know, which is nice. So if you have a house down in the vineyard and you need help
right.
with your mother, you know, we could go to the vineyard.
They'll jump
you
on
know?
the ferry
Yeah.
and
Yeah.
take care of you.
Yeah,
Wow.
yeah. And then with nursing
I'm
homes,
surprised you get people, hired people to do that. You're really putting yourself out.
but that's, you know, as far as when people are coming to this country and looking at, you know, healthcare is always going to be there. You're not going to really be
Right.
laid off.
No,
You know?
it's getting bigger all the time.
Right,
Right.
right. And
Especially as
there's
the
a need.
population is aging.
Right. I mean, you know, think about it. 15, 20 years ago, the average age of living was like 82. Now you have more centurions, more 100-year-old
Unbelievable,
people than
isn't
you
it?
ever had in your life.
Yeah.
And, you know, assisted livings, when they started 20-something years ago or 30-something years ago, the average age that went into assisted living was 80. Now they're going in at 95, 98.
Right.
So their lifestyle is totally different than when somebody was going in 30 years ago, 80-something years old.
Right.
You know?
You got people in their 80s that are still working.
Absolutely.
Oh, yeah, definitely.
Absolutely.
Yeah.
Unfortunately, just go to the grocery store. You have to, right?
Right.
Yeah.
To pay for
Exactly.
your groceries,
I
or pay
know.
for your medication, or pay
Yeah.
for
Right. To
having
survive.
a roof over your
Yes.
head or whatever.
Yeah.
So
Yeah.
and there it's I would say the percentage in the nursing home industry as well as home care is primarily female. So
Right.
it's good for females, and an area for growth also. We have a lot of staff who started out as home health aides, then they became CNAs, then they went on to nursing school, and they're RNs now. So
Exactly.
there's room for growth, which is nice. So
Right. Yeah, my wife was a CNA. She never wanted to go on though. She didn't want the responsibility.
Assisted living, correct?
Yeah, last,
Is where she
finally,
worked?
the last job was in
Oh, these.
assisted living.
Okay. All right.
But she never wanted to go on beyond CNA because she didn't want the responsibility.
Right. There is
Right.
a lot.
it
Yeah.
is. And even as a CNA, there's a lot of
Yeah.
responsibility. So
Right.
you really have to cross your T's and dot your I's these days, and
Yeah,
and you're dealing a lot of times, as we know, family dynamics come into play, and that son that probably hasn't talked to mom or seen mom in 10 years, and all of a sudden I'm going to make the decisions,
Right.
so it's important
Right.
that you have in place someone who is a healthcare proxy who can make decisions for you if you can't, and if you can do a power of attorney, so that if you've got multiple children, they're not coming out of the woodwork arguing of who's going to make the decision. Mom's wants this. No, she told me this 10 years ago. Well, 10 years ago has changed. She's got advanced Alzheimer's, and now she's saying,
Right.
I want this.
Right.
So, you really need to have someone assigned to be able to make decisions for you when you can't.
Right.
And most people don't even have that.
No.
you really should, I've already filled out that
Mm-hmm.
paperwork.
Good.
It's very important.
Yeah, because my son's a doctor.
I was going to say,
so-
I think your son had something to do
Right,
with that.
right.
Yeah.
Or at least
And,
I hope he
and-
did.
And, especially with yourself, any of the senior centers, you can come in and you can sit down with them and help them fill out paperwork and do a healthcare proxy. Recommend if they need a power of attorney. Some
Absolutely.
people that I always emphasize, go to an elder law specialist. Don't go to the lawyer that got your kid out of that, time he had to go to jail
Right.
because he was drinking in school or something.
Right.
You want to go to an
Yeah,
elder law
right.
specialist. You
Yeah,
know?
because elder law is completely
It
different.
is.
Right,
Yes.
right.
Yep.
And if you can, as you age, look for a geriatrician. Those are doctors who specialize in the age of 65 and above.
Yeah,
They're
my
not
son.
65.
Yeah.
They're
And
usually
they're-
younger, but they specialize in the aging
That's my
in
son.
place. Is a
Good for him. Because
Geriatric.
they're hard to
just-
find.
Yeah, very
Yeah.
much so. So, again, that's another specialty. Instead of saying, well, I'm just going to choose this doctor. Well, what are your needs? What are your
Right.
complications? Are you healthy? Do you think in 10 years from now you might have diabetes, which is now going to affect multiple situations as you age? And people don't think of that, unfortunately. So I just stress, be advocates. I call it Dr. Google. You can Google anything now and get
Oh,
an
I know,
answer.
it's amazing.
It's scary. But at the same time, it gives them a wealth of information, sometimes too much information.
Exactly.
Yeah.
Yeah.
When I've had people come in and put down on paper, this is your star rating, and have a series of questions where, you go through them with them for an hour or so, and they still don't have the answers that they want, because a lot of them are in denial. They don't want to make that decision
Right.
because you always promised mom that you would never put her in a nursing center. Well, now
Right.
you're living in California, and mom's living in Northbridge. How are
Yeah,
you
how
going
do
to?
you
Mom's
care?
not moving to California,
No.
and you're not moving to Northbridge.
Right.
So how do you take care of what
How do you
happens?
care for it?
Right. What are my
Right.
options?
Yeah. Yes.
But same
very
with,
important.
what DNR is.
Mm-hmm.
I think that's something you gotta do when you're a lot younger,
Right.
because you may change your mind later on,
Mm-hmm.
and that do not resuscitate,
Right.
for people wondering what I'm
A
talking
DNI
about.
and a
Yes.
DNR. And
Yeah.
most of your doctors will ask you that now. They're really
Yeah.
trying to educate, so
Right.
that's
I
in
think
your
it's good
paperwork.
because, you want to, don't put that burden on your kids.
Exactly. Yep. That's a
make those
conversation to
decisions.
have when
Right.
you're,
And again, those family dynamics where,
Yes.
the son comes out of the woodwork that hasn't even
Right.
seen mom in 5 years, and he's going to come in and make all the decisions.
right.
You know, and the daughter who's been faithful and lives next door and is there every day and has been holding her mom's hand through everything says, "Oh, I'm not the healthcare proxy. My, you know, brother who hasn't seen anybody in 5
Yeah,
years
he's not even around.
he's going to start making the decisions,
Right,
and
right.
he doesn't even know what's going on."
Right.
So yeah, the family dynamics, as you know, is always very interesting.
Yes, it is.
You know, but I think the senior centers are great for helping people and guiding
A wealth
them.
of
And
resource.
you all have some great outreach
Yes.
specialists within the senior centers that you can connect them with. You know, there's the PACE program, which is wonderful. So, you know, it's like adult daycare. There's many private adult daycare centers that people can go to and still, if you're a caretaker, you can still work. Your loved one goes to an adult daycare center during the day. They're safe. They're got activities. They're got, you know, toiletring, food, what have you, lunch, breakfast, their medications, reminders, and then they come home, and so you come home at the end of the day, and you can still be that caretaker,
Exactly.
but you get that little respite also, which is important because, as we all know, caretakers always just get so overwhelmed, and then something happens to them, then that's another whole separate can of worms. So now
Yeah.
mom's in the hospital, and you're down the hall in the hospital.
Right.
Yeah. Now the caretaker needs care.
Right, and they were
Exactly.
saying, well, we want to send
Which
mom
happens
home. Well,
very often.
you can't
Yep.
because the caretaker is in the hospital
Yep.
Right.
because something happened,
Right.
you know, and the stress level is incredible. And, you know, we're all caretakers for some loved one, you know,
Yes.
be it your children, your grandchildren, your aging parents, aging loved ones. We're all caretakers. And we need to take care of ourselves also,
Exactly.
which is
Oh,
important.
yeah.
Yeah.
When you start out, they're changing your diaper, and then
And then it
at the end, you're changing
kind of
theirs.
evolves
Right,
into
right. We get a lot of calls
Yes.
and a lot of sons lately for some reason, and they're saying, "Well, you know, I think I'm going to take my mom home, and I can do this." And then 2 days
Until they
later,
get
I get a
here.
call, and they're like,
I can't do
I
this.
tried to get her in the bathroom, and I couldn't do it, you know." And you say, "Okay, let me walk you through this,"
Right.
you know. But you know, everybody thinks like I'm super person, I can do anything until you're,
But
you
it's
know,
also
giving your mother
way
a
of
shower.
doing things.
Yeah.
Yeah.
You haven't been trained, and there's a way of doing things. and
Right.
You haven't been trained to do
Right,
that.
exactly.
So
you don't
you
want
can
that
hit-
person to fall when you're
No,
trying to
and you can
transfer
actually hurt
them,
'em.
you know, or assist them and they're
Right.
in a wheelchair
Yeah.
or a walker or a
Yeah.
cane and they're
Don't
using
move
some
me this way, it
apparatus.
hurts.
Yeah.
Because you don't know.
Right,
Right.
exactly. And sometimes you'll hurt them and re-injure them or
Yeah.
hurt yourself. You
Right.
fall. You both
Exactly.
fall.
Yeah.
Now you're both on the ground. So,
Right.
you know, and there's a lot of, you know, we always laughed years ago, the ads, "I fall, but I can't get up." Well, there's a lot more sophisticated now. They're on an iPhone, a watch, what have you.
Yes.
Very important to have for your loved one. It's not that expensive per month, but multiple companies offer different programs, and it's so important because you could go out to get your mail at the end of your driveway and you fall
Yeah.
and it's sub-zero. No one's driving by seeing that you're on the ground. If you have
Exactly.
that, even there's some that are so sophisticated now, before you fall, as you're leaning, going down,
I had
it
that
goes
happen.
off.
Senses it.
It
Right.
happened to an uncle of mine at Postma.
Oh, right.
I bought him a remote phone. He never had a telephone in their house.
That's right. Yeah. Yeah.
Well, when his wife died, he got one because she got sick, and he had to drive down to the police station
Oh,
because they didn't have a phone. They didn't want a phone.
wow.
Well, anyway, I bought him a remote phone. I said, "Now, if you, anywhere you go, take it with you." 'Cause he didn't want an alert because he had to go down cellar every night because he had an old furnace and he wouldn't renew that, and he had to fill the tank.
Here's a stubborn Yankee.
Oh yeah, he had to fill the tank with water every night
My gosh.
by hand.
Right.
Well, not by hand, but turn the valve.
Yeah.
Well, anyway, he went down one night and he tried to get back up. He had arthritis very bad. He would go up on his rump one step at a time, and he got all the way to the top and fell down.
Oh my gosh.
Spent the whole night, didn't take the phone with him.
Yeah.
Fortunately, my other uncle, his brother-in-law, went to check on him, and they found him in the basement. He ended up in a nursing home.
I mean, how many times you find someone has fallen and all of a sudden, you know, a neighbor or a mailman's like, "Hey, the mail's piling up here, the
Yeah.
newspapers, something's wrong." They call the police, they go and do a wellness check, and they find that they've been on the floor for 3 days. So
Yeah.
very important, you know, to even have a little cell phone or, an
Right.
apparatus that can pick up if you've fallen and can notify.
Especially today, everybody's got a cell phone. It's so easy to
definitely.
take that with you.
My
Yeah.
94-year-old dad has a cell phone, and it's a modernized flip phone. And he always says, I don't know what happened to all the numbers. I didn't press anything, but they're all gone. And I go, no, you had to press something. And so I go, let me come over and spend another hour implementing all those
Right.
numbers that you deleted that you never pressed a button for. But, he's 94,
Yeah.
so he didn't grow up with that technology, you
Right.
know, but, he carries it with him at all times now. And, that generation was such a proud generation,
Yep.
and they never asked for help.
No.
Never.
But the medical alert systems, those are well worth it.
Yeah, they're definitely
Yes,
worth the
yeah.
investment, but that generation never asked for help. So a lot of times when people are looking into home care, be it the VNA or private home care, they have a hard time saying a stranger's coming into my house. I've
Yeah.
never asked for help.
Help.
I do everything myself.
Right.
Because they're such a proud generation, and that's a lost generation because,
Well, you
Generation
also,
X and Z's and whatever they are. Yeah, no,
if
they're
you
very
can't do it
different.
Yeah.
yourself, you start to feel like I'm losing it now.
right. Mm-hmm.
It's hard to
Yeah.
it's hard to come
It
to.
is. It is, and it's important. If you want to stay at your home and age in place for as long as you possibly can, till your next decision is. It's important to have care coming in and let
Right.
somebody come into your house. And it's a difficult decision to be made, but once you do it and you realize that that person's there for your safety, for your loved one or yourself, and they're there to help you.
Exactly.
Well, I know, Kelly has a Meals on Wheels program,
Through Tri-Valley. Yeah.
and that's important because
Yeah.
that's the only people they see, right?
Well, that's another form of a
Right.
wellness check.
Right.
Yeah.
So-
And it's their socialization.
Exactly.
Yeah.
Yeah.
It's
But
not
they check on
necessarily
the
the
person.
food.
Right. I know.
They're
But,
going to the home and they're checking and they're
exactly.
okay, yeah, they're still here, they're still alive.
And that's a great thing, again, going back to caregivers that work full-time.
Right.
Who's checking on mom during the day? Or,
Right.
Yeah.
Or she has a cardiac situation.
Exactly.
She's on a low sodium diet, and
Yeah.
she's eating all these things,
Yeah.
potato chips that when you go over, and you're
Right.
like, yeah, you shouldn't
Yeah.
be eating that,
Yeah.
So
Or he has had a medical event, and the driver arrives at the house, and there's no response to the door. So our nutrition manager, puts the wheels in place, so
Yeah,
to
makes
speak,
the phone calls.
and makes those wellness calls,
Yeah,
checks,
right.
and so
and Tri Valley is another great elder service program
resource.
that
Yeah.
services many communities out in this area, and they just have so many programs and elder services
Growing.
in Worcester and
Yeah.
and the other one in the Marlboro area, and then there's one up in the Leominster Fitchburg marketplace, and they're great resources also
Absolutely.
because they have so many different protective someone's, unfortunately we see it all the time, a family member or a neighbor or whatever said, oh, I'll take care of your checking book for you. I'll do this. I'll do your banking for you.
Right.
Well, unfortunately, sometimes there are people that don't have scruples, and they're taking that money. So,
Yes.
part of some of the elder service programs or protective service division is to make sure that that money is not being taken and used where it should not be used. And they're, not using their credit
So you
cards.
do have a program where you actually take care of the person's finances?
Through Tri-Valley,
Really?
they
Yeah,
have a
they
bill
do.
pay program.
Which
Yeah,
is
that's a
Yeah,
good idea.
it is.
Yeah.
It's
Very much
fabulous.
so.
A lot of these folks, well, most of them are volunteers, and they come from financial
Yeah,
backgrounds.
a lot of them
Yep.
are retired bankers.
Yes.
Yeah, which is
And
nice.
today you can do a lot of it electronically
Oh,
online.
yeah,
so it's
absolutely.
Absolutely.
Yeah.
Yeah, and a lot of the banks now are really educated too, as unfortunately, all these scams are out there now, and
Yes.
AI can make it sound like your grandson's calling that he's being held, and that you need
Exactly.
$5,000, Grandma,
Oh,
and
they
it
could say
sounds
the
like his
police-
voice, yeah. And
police
she
in
goes
this
to the
town have
bank,
seen that.
right, and goes to the bank to try to extract $5,000, and the tellers
Well,
now
one
say,
man, I think gave up
"Let me talk
15
with you. Why are you doing this?"
Gave
you
up
know?
$15,000 on a phone call.
Yes, I know.
You
I
heard
know.
about that.
I did
Yeah.
hear about that.
Yeah.
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 And we're called every day with scams ourselves. I love when they call and
It's
say,
horrible.
"Oh, this type of computer," and I go, "I don't have a computer," and they go,
Exactly. Yes.
You throw them off
Gotcha.
their script, and you're like, "Bye, don't call me again, please."
Yes.
So, but yeah, and it's unfortunate people, take advantage of every situation out there. So.
Yeah, the Medicare calls, God, I mean, and
Mm-hmm.
some of these people don't even speak English.
No.
Right.
Yeah.
We were just saying, just became a Medicare recipient myself, and I was inundated. I felt bad for my mailman. I mean, because every day
Yeah.
up to my birthday, I was getting this much from all the different
You're still gonna
Medicare
get them.
programs.
I get them all the time.
And I used to look at him and I go like, oh yeah, I guess you know I'm what age I turned. He goes,
It's
yeah.
happening.
He goes, he's got,
I've been
I
on
can't even
Medicare
fit it
for-
in your mailbox,
Yeah.
you know.
I've been on it for 10 years, and I get
Yeah.
Yeah.
barraged with call.
No,
Yeah.
But that's because you can change.
Right, every
Right,
year it's
open
open
enrollment.
enrollment. But again, that's overwhelming too, because years ago you had like 2 choices in insurances, right?
Right.
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 And now you've got
Too many-
Medigap, you've got
too
all
many
these different
choices.
supplemental incomes.
Yeah.
I was telling him the story. I went with a newer supplemental program, and I called the other day, the 1-800 number, and I said, can you send me a provider list of your providers, which providers meaning within your network, being physicians, specialists, what have you. So I'm thinking it's going to be this thick.
Right.
I get home the other day and my husband goes, what did you order? UPS delivered this big box. And I go, I didn't order anything. So I'm like, let's open it up. It was a 3-ring binder and it was 700 pages.
Oh, no.
I took it out and I looked at the table of contents and I go, 1-800 number. I called them and I said, so is Dr. Smith on? Is Dr. Jones on? Is Dr. And they go, yes. I go, good, because I wasn't going through 700
Right.
pages. I was
Yeah.
thinking,
Yep. It's unbelievable, isn't it?
yeah, and I laughed, I'm in the industry, and I
Right.
laughed when I got it, and I was a little overwhelming. So can you imagine the average person, aging
Exactly.
person, getting that going, I can't even lift it out of the box, never mind
Right.
look to see if my doctor is listed.
Oh, boy.
Yeah, so.
That's why, if you go on Medicare, you need an advisor
Oh,
Yes,
absolutely.
to
Medicare.
get you through
Absolutely.
the.
And our friend Russ
I was
is
going to say,
wonderful.
again, Russ!
Yeah.
Yeah.
Russ helped me out. I've known Russ for years, and I'm in the industry, but I never, I dealt with Medicare on a different level, being in a nursing home and home care industry and other variations in the healthcare environment. I never had to choose myself what I wanted to do.
Right.
I was always on Blue Cross,
Yeah.
And then I called him and I go, can I meet you for coffee? Because you're going to run by me. I said, give me like the quick
Where we
cliff
going?
notes, right? Of like, I felt like I was back in college. The cliff notes. I need to find out, okay, blah, blah, blah. This is what I need to like look at and what my needs are and this and that. And he was wonderful.
Yeah.
And he simplifies it.
Exactly.
Yes.
He speaks
Yeah.
plain English.
Yeah, he speaks
But
Medicare.
there's
is
Yeah,
what
he
he
speaks
says.
Medicare.
Yeah.
That's right.
We have a friend that his wife was on Eliquis,
Mm-hmm.
and the price is unbelievable.
It is. Yeah.
So she wanted to get on to the prescription program.
Mhm.
Because they hadn't joined it right away, now you gotta pay a fine.
Penalty.
Penalty.
Yeah, penalty, yeah.
A penalty, I mean, that's
I know,
ridiculous.
I know. And you know what, again, all that paperwork that you get, all that information that you get, it really doesn't detail all that, so you really
Right.
need a Medicare
Now, if
specialist.
you didn't know that, like they didn't know it,
They didn't know it, and now they're paying
and
for
now they're
it.
paying for it.
Literally.
Yeah,
Right,
for
yeah.
not taking it
Yeah.
for 10 years.
I know, it's the
Right.
same thing with Medicare, 3 months prior to turning 65, 3 months after 65, but if
Yeah.
you're on, let's say your husband is still employed or what have you, or your spouse is still employed and you're on their insurance,
Right,
you don't have to, you can apply for A and B, you don't have to pick up a supplemental program.
right.
But, after that open window, if you pass that, it's very difficult.
It's,
Yeah, you
check.
get, you get a
And
people
penalty.
don't
if
realize
Yeah,
that,
you end up
right.
with another penalty.
Right, exactly.
Yeah, it's ridiculous.
Exactly.
I mean,
yeah,
really is.
Yeah.
it is. So,
You think it's a great program, but they make it so difficult.
and I had to call to ask a question, and I couldn't get online, so I said I'll call, and I timed it. It was an hour and a half, and I just kept on listening to the same music tune that they kept
Oh,
on playing
I
over and
hate
over.
that.
I was like, I had my cell phone, but I was at home, so I had it plugged in, charging, because I would have lost all my battery time
Right.
waiting, and then it was to simplify, and they're
Horrible.
like, and I laughed, and they're like, your call is very important.
Yeah,
I'm
I
like,
know.
no, it isn't, because you haven't taken it.
Yeah, you haven't taken it for the last hour.
Right.
How important can it
I
be?
know, I know.
Me and 100 others.
Yes,
Yeah.
I know.
Yeah.
I know. So, but I think what's nice is we have so many options in this area, as I said, and if
Well,
I
it's
can't
great to
stress
have the
enough
options,
to be
but
an advocate, yeah,
It makes it awful difficult.
it does.
So,
It does.
you got to get a hold of someone like Russ.
Right.
Yeah,
right,
definitely.
absolutely. And I think options for regarding home care and, different insurances that you have,
Right.
as well as hospice,
Well, that's another
assisted
question.
living, nursing homes.
Yeah, when you're in your fifties, you're getting this information about
Mhm.
buying long-term care, and you
Right.
think, do I want to buy that?
That's the time that you need to buy it, and you're in
Yeah.
your 50s,
Exactly,
and you're
right,
healthy, and
right.
the premiums now,
The premiums
there's
aren't
only
too
like
bad.
5 in the country left.
I was gonna
Years
say,
ago,
are there any? I haven't even
there's
heard
like
of any.
5. Yeah,
Okay.
we get a lot of people that still have long term, and
Yeah.
we were able to utilize it towards their care. But I mean, probably 10 years ago, there were probably 25, 40 companies.
It's not a
No, there's like
profitable
5.
business then. They're probably
Not
getting out
anymore.
of
They
it.
used to
tried.
think so,
They
but then
tried,
as
yeah.
people lived longer,
They're living longer.
Yeah,
and
they're
they're
like,
longer
oh,
Right.
whoa, this
Right.
isn't gonna work so
yeah,
well.
and they
Yeah.
bought these great plans back
Right.
then because they wanted people to buy the plans. So they
Absolutely.
were throwing everything in the kitchen sink at you, right?
Yeah.
You're like,
Yes.
oh, I only have to pay this monthly.
Right. Yes.
Right. So now it's like coming back because now I was saying, yeah, I want you to pay for my assisted living. I want you to pay for, my home care, my hospitalization, and
Right.
Yeah.
depending on what, program you had, what policy you bought, and what your premiums
Yeah.
were, they might be paying out all this.
Yeah, paying
So,
out quite a bit,
yeah.
yeah.
Absolutely. So, questions that you have for me at all?
Yeah, now you handle if they want to go into assisted living?
I don't, but I'm a resource and I can recommend people. I work.
'Cause
I
that's
can use the
becoming
term
very-
Rolodex still. I have a Rolodex of people. You can see that I turned 65. I use the term Rolodex, but I have a slew of resources that I can
Because that's a
make phone
relatively
calls.
new industry as well.
It's about
20, 30
30
years.
something years old now.
Right.
Is it?
Yeah, and then it's like,
Still
now
feels
the,
new.
the independent 65, 55 and above, 65 and above. Some beautiful, I go in to see what they're like, and we have some clients that are in some beautiful condominiums for 65 and 55 and,
Right.
and beautiful prices. They go with that beautiful
Of course.
condominium. Yeah. So, but again, sometimes too many options, but it's nice. And I just wanted, before closing, I just wanted to leave my telephone number if possible.
Oh,
if anybody has
absolutely,
any
yes.
questions. So Accessible Home Care is a private home care agency located in Auburn. We're women owned, and one of our co-owners is a clinical director as well as an RN. Our telephone number in the office is 508-859-1644. 508-859-1644. And Shrewsbury Nursing Center and Outpatient Center, which is still privately owned. It's based in Shrewsbury. It's been there over 50 years. The number is 508-845-6786. Again, that's 508-845-6786. And I recommend you can go on either website for either organization. And,
Where are they
and read about it.
located in Shrewsbury?
On Julio Drive. So right between Route 9 and Main Street.
Oh, okay.
South Street, Julio Drive.
Yeah,
Yep. So Southgate is there too, which is an assisted independent living as part of the same organization. And there's some physician offices, and there's actually like 3 homes on that road. So years ago it was Julio Markets.
yes.
They were there. Now it's a bank where Julio Market was. So they owned all that property.
right.
So,
Okay.
Oh.
because I'll have people go, "Is that Julio Drive?" And I'm like, "No, it's
Julio.
Italian. It's Julio Drive." It was named after Julio. Now people call Julio Liquors, which is in
Yes,
Westboro.
Westboro,
Right.
Same
yeah.
family, but years ago it was an incredible grocery store.
I
Oh,
bet.
yeah.
Yeah.
Yeah. So they're located
Wait,
there.
here again, they were a local grocery store, but they couldn't keep up.
Right, times changed.
Exactly.
Yeah, they couldn't keep up with
locally
the
owned
major
and-
chains.
Right, right.
Yeah.
So, but that whole area it's right off of Main Street.
Right.
Yeah, going not far from Dean Park, that area, part of Main Street, not in the center of
Yes.
town, but right down the street. So
Yeah, nice area. in
it's a
town.
very
Yes.
nice area, and we've got I forget how many acres of land for walking, and then there's a bandstand, and they do music in the summertime out the bandstand
Nice.
and open it to the public to come. And we have intergenerational. We have the kids come from the different parishes and the schools, and they'll come and intergenerational programs that we have through activities, and you can participate in the activities. It's not just bingo anymore.
Right.
My friend was there the other day and said, "Oh my God, they were doing a Elvis impersonator. It was really good, and they had blue suede shoes." But it's again, different
But
activities.
that's showing in the aging population. I once said, pretty soon nursing homes are going to be playing music from the 60s.
Yeah,
That's
they
it.
will. When our generation starts,
Yes.
it's, you
Yeah.
know,
Yeah.
I don't want to play bingo. I've never played
No,
bingo, and I
no.
really have no desire to
I
play
don't
bingo.
have bingo at my senior center. I got rid of it.
Yeah.
Yes.
Yeah,
It's
you-
another form of gambling, basically.
yeah, you're seeing things change as,
Yeah,
the
yeah,
population
absolutely.
is
Yes.
changing.
Absolutely, and
Yeah.
you know, everybody now, you know, everybody's got tablets, and you know, things from
Yeah.
you know, IT perspective has changed. Where you know, 20 years ago, you didn't even have a TV in your room if you were in a nursing center.
Right.
Now you
Right.
got Wi-Fi, you got your tablet, you've got
Hey,
your
yeah,
cell
yeah.
phones, you've got everything. Yeah.
Yeah.
You know, so changing with the times, and you see that with a lot of independent and assisted livings that are coming in now. They're very, I just went to one that opened up recently in the Metro West Marketplace, and it's very ultra modern. Like I felt like I was in New York City, where 20 years ago when the assisted livings were being built, their architectural design was very homey.
Oh, right.
And now I walk in and I felt like I was, you know, on a cruise ship or in a high-end hotel in New York
Yes.
City.
Yep.
And so you see
It is
how they're
amazing.
building for the future,
Right.
when we'll be moving in.
Yeah, even hospital rooms.
Mm-hmm.
It's so much different
If
today.
you can get a room these days.
Yes.
Exactly.
Well, we
Yeah.
got to wrap it up.
Yeah.
We're
Okay.
gonna wrap it up. Okay.
Well, thank you for having me as a
No, my
guest. And
pleasure.
my name again is Lynne Alexandrowicz. If you have any questions, feel free to give me a call. And I try to always be a resource, having been in this industry for many, many years. As Kelly and I said, we started when we were really
Yes,
young.
very young. Very
But
young.
you know, we tried. If we can't directly help you, I'll find someone that can.
I was going to say, we know people.
Yes, exactly.
Yes.
Exactly. And that's what's important. So you don't feel like you're an island,
Right.
you know, and you're overwhelmed, and it's such a hard, difficult decisions to make anyways. You should have the resources in place so you can make the right decisions and advocate
It's a
for
very
yourself.
important decision.
And
one
don't
of the
wait
most
until you're in
important
the
decisions.
crisis.
Right,
Yes.
which people do.
Try to be proactive and
Absolutely.
start
Absolutely.
talking about it sooner than later. So, all
Yeah.
right.
We still got a couple of
Wonderful.
minutes.
We got a couple of minutes? All right.
Yeah.
We had no
7:50.
calls, so
We got
that's
another minute. No
Do
Okay.
people call in? They can call
Sometimes.
Yeah, they
Yeah.
can,
Okay.
but we don't get too many
not
calls
too many. No.
because they're interested in the subject.
in. Right.
Yeah,
They're
they don't want to
interested in
interrupt
listening.
us.
They don't want to call and screw
It's
it up.
like Rush's show too. You do the radio show, which I
Yes.
did last week
Yes.
and the week before for representing Shrewsbury and representing Accessible. And he's telling the number, but again, people listening, not
Right.
calling in.
Right.
So
Yeah.
Yeah, I run into people and they say, I said, why don't you call? No, I was interested in what you were
Right.
saying, what I was hearing.
right.
I
Right.
didn't want to call.
Yeah.
So that's good too.
Yeah, very much so. And again, it's just an educational aspect for the communities out there. And, you know, everybody's going to have to make that decision eventually, be it yourself in the hospital, a loved one in the hospital,
Yeah.
or, you know, aging parents and
Right.
you need care, or, you know, someone
Well,
now has
if you-
Alzheimer's and they're, you know, exit seeking, and all of a
Mm-hmm.
sudden, you know, the police get the call that I haven't seen mom in a day. I don't know where she is.
Right.
You know, she's
Yeah.
now walked, which is an unusual, she's walked 10 miles with a walker,
You know,
Right.
it's
you
like
know? Yeah.
Right.
people say, I don't want to get old. Well, the alternative is.
Right. Right.
Yeah.
Exactly.
gonna happen.
And if you
Exactly.
do get old, you're going to make decisions when you get there.
But let's make good decisions or
Right.
try to. Yeah.
Right, right. And again, everybody's in denial because I'm never, you know, I'm always going to be healthy. I'm never going to be sick, and I'm never going to have to be in a hospital.
Yeah.
Yeah. It's a good thought.
Yeah.
But, yeah.
I'll be 76 in a few months. I never thought I'd make it this long.
Right? But, you know, think of it. Like, you
And
know,
what did we say though?
parents lived to be
Stay
50s years
yeah.
ago.
Stay active.
That's the key. You got to
Yes.
keep
Right.
your mind active, keep
Yeah.
your body active,
Definitely.
and watch what you eat because
Absolutely.
you know you're going to feel it later on.
That's right. Take care of
But, yeah.
yourself. And,
Everybody wants to get to heaven, but they're not in a hurry to get there.
Right.
no.
Right.
No.
Right. Well, some people go to the other one too.
Right.
Oh yeah. We know a few of those.
Yeah.
Yeah. Hey, when you start seeing family members go, you know it's coming their time. So,
Right.
you know, you really got
I feel like for a while there, you know, as we have friends who are aging and their parents and what have you, I probably went to maybe 5 or 10 wakes, and I thought, oh my God, it's becoming like a social hour. I'm going
Yeah,
to a wake.
there you
That's
go.
true. That's when you run
once
into
or
people.
twice every
that-
month,
Yes.
yeah.
We got to wrap it up now.
Yeah. Oh, we do. Okay.
Thank you
All
for all.
right.
Thank you so much.
See you
I
next week.
appreciate you
Good night.
having me as a guest.
Thank
Thank
you.
you.